Imagine living with crippling anxiety and knowing there's almost no chance you'll ever get help. Good evening. Today's briefing looks at anxiety disorders in Mexico, a condition that lays bare the cracks in a fragile health system. Nearly 8 out of 10 people with anxiety never receive treatment. In many regions, there's actually less than one mental health worker for every 10,000 people. These are not small gaps. These are systemic failures. In Making Waves, Transforming Anxiety Treatment in Mexico, I'll show how anxiety exposes weaknesses beneath the surface and present strategies to reduce the burden, expand equity, and build resilience. Two young fish are swimming when an older fish swims by and says, "Morning, boys. How's the water?" The younger fish look at each other and ask, "What's water?" Like those fish, we often don't notice the systems we live in until they fail us. Mental health care in Mexico is that water, underfunded, centralized in cities, and inaccessible for many. Stigma and inequity remain invisible forces shaping outcomes long before someone ever steps into a clinic. To change the future of anxiety care, we have to change the water itself. We have to change the system. Measured in disability adjusted life years, or DALYs, anxiety disorders account for the loss of over 500 healthy years of life for every 100,000 people in Mexico. That makes anxiety the second leading cause of mental health burden after depression. That's higher than bipolar disorder, schizophrenia, or eating disorders combined. Not to mention the fact that a lot of these disorders are often co-occurring disorders, meaning you can have conditions from more than one at a time. Now, this isn't just a medical statistic. It means lost school years, diminished work productivity, and families living with daily uncertainty. Each number on this chart represents thousands of lives constrained by untreated anxiety. Mental health access in Mexico is not just a question of resources, it's a question of rights. When care is underfunded and concentrated in cities, inequity becomes the norm, and those in rural or marginalized communities often have lesser economic means are left behind, forgotten. Treating mental health as a human right shifts the system. Funding has to follow proportional need. Services must extend beyond urban centers, and equity becomes the baseline for reform. Rights turn mental health from an afterthought into a public obligation. Anxiety is shaped by the conditions people live in. Poverty and inequality create constant insecurity, while the stresses of a dense, overcrowded urban environment intensifies the strain. In rural regions, isolation leaves people with even fewer options for care and for socializing. On top of this, environmental pressures from extreme heat to droughts and floods amplify distress and destabilize communities. These factors show that anxiety is not just a medical issue, but a reflection of the socioeconomic and environmental realities around us. Despite the scale of the problem, Mexico devotes only 2.2% of its national health budget to mental health. That's according to the most recent systems analysis by Oropesa and colleagues back in 2021. That's nearly 8 times less than proportional need. Unfortunately, Most of this limited funding is absorbed by psychiatric hospitals in major cities, leaving rural and marginalized communities with virtually no access. For many, seeking care means long travel, high out-of-pocket costs, or waiting months for an appointment. The result is a treatment gap where millions live with anxiety but never receive care, not because it's untreatable, but because the system makes it inaccessible. Closing the treatment gap requires more than funding alone. It requires rethinking what the system is built to do. Our proposal is anchored on three guiding priorities: prevention, community, and equity. Prevention means addressing anxiety before it escalates into crisis. Community means investing in services where people actually live, work, and learn, rather than concentrating care in distant hospitals. And equity means directing resources to those with the greatest need, not just those with the easiest access. Together, these principles reshape mental health care into a foundation for resilience and flourishing, not simply a safety net of last resort. Our first priority is primary intervention, stopping anxiety from becoming debilitating before it reaches a clinic. The clearest path forward is a national anti-stigma campaign. Anxiety is often hidden, dismissed, or misunderstood, which delays care until symptoms are severe, until it's too late. By mobilizing schools, workplaces, and media outlets and amplifying trusted community voices, we can normalize seeking help. The outcome is measurable: more people reaching care earlier, less strain on hospitals, and lives restored before anxiety becomes disabling. Prevention also means catching anxiety early and supporting recovery when it becomes chronic. At the secondary level, we recommend routine screening for anxiety in primary care clinics. Training general practitioners to identify symptoms early ensures people are connected to care before the conditions worsen. At the tertiary level, the priority shifts to recovery. We propose expanding community-based therapy hubs that integrate counseling, medication management, and peer support. These centers reduce relapse and help individuals return to work, school, and community life. Transforming anxiety care requires a funding model that is both resilient and sustainable. Our framework rests on three pillars. Government investment provides the anchor, expanding resources beyond centralized hospitals and ensuring accountability. Global grants from the World Health Organization, for instance, and philanthropic partners act as innovation capital, funding pilot programs that can be scaled nationally. And finally, community and private partnerships, from NGOs to social impact investors to angel investors, bring local ownership and help programs survive beyond political cycles and uncertain economic times. Together, these three streams balance stability, innovation, and stability, creating the financial foundation needed for lasting and transformative change. Transforming anxiety care, therefore, is about more than just services. It is about changing the system beneath the surface, a system rooted in rights, equality, and resilience, one that shifts from reactive treatment to proactive prevention, one that integrates mental health into broader policies on housing, environment, and social welfare. The impact is generational. Communities with equitable access, reduced disease burden, and greater resilience in the face of challenges. Real transformation begins below the surface. And when we change the water, every person can thrive.